like we are It looks like we are right at the top of the hour at 2 o'clock p.m. Eastern Time. On behalf of the National Aging and Disability Transportation Center, we want to welcome everyone to this webinar. We will be having a conversation with the Fallon Piaute Shoshone Tribe all about how they have leveraged their ICAM pilot program funds to grow on-demand services for tribal elders and persons with disabilities. I am Laura Jane Ward-Strunin. I am a program manager with NADTC and glad to have you all with us. Next slide. To get us started, I wanted to provide a few quick instructions for how to participate with this Zoom webinar. Right now, all of you as participants are muted with cameras off. As with all of our NADTC events, this session is going to be recorded, and the recording, as well as associated materials, like the slides that we'll be speaking from today, will be posted on the NADTC website. All attendees will get an email notifying you when those have been posted. Also, I wanted to let everyone know that we have a live captioner providing us captions today. The captions can be accessed by clicking on the CC button at the bottom of your screen. If you have questions for the presenters, we ask that you use the QA button, which is towards the center of your screen at the bottom, and we'll save some time at the end to address those questions. Also, you can use the chat feature to post general comments, engage with other attendees, or request technical assistance. Next slide. For our time today, we are going to briefly introduce NADTC, discuss the Innovative Coordinated Access for Mobility pilot program, and then we're going to go into the conversation with the Fallon Piaute Shoshone Tribe to discuss how their ICAM project is going to grow on-demand services, and also how this fits into their overall plans for growing their transportation services to meet the needs of their tribal elders and persons with disabilities. And then we'll go into some question and answer that you all may have. The National Aging and Disability Transportation Center, or as I've mentioned, NADTC, is a federally recognized technical assistance center that is funded through the Federal Transit Administration with guidance from the Administration for Community Living. NADTC works in partnership between Easter Seals and U.S. Aging. Our overall mission is to promote the availability and accessibility of transportation options to serve the needs of older adults, people with disabilities, their caregivers, and our communities as a whole. Next slide. And the way that we meet our mission is to provide resources and supports that help agencies address transportation challenges. This looks like providing technical assistance through person-centered approaches, through our toll-free number, our emails, through webinars like the one that you're on today, online courses, as well as presentations at conferences. Our website is full of publications and resources, as well as a photo gallery, blog posts, toolkits, and all kinds of resources that focus on accessible transportation and ways to build partnerships and coordination. We also offer community grants to programs that are looking to develop innovative ideas for increasing the availability of transportation options. You can find us through our website at www.nadtc.org and on all social media. If you have not already done so, you are all invited to sign up for our monthly newsletter on our website. Next slide. So before we get started, I wanted to talk a little bit about one particular component of the services that we provide through NADTC. We provide person-centered technical assistance to certain FTA-sponsored grantees that include the Innovative Coordinated Access and Mobility grantees. And I will reference throughout this webinar, instead of saying Innovative Coordinated Access and Mobility, I will use the abbreviation ICAM. To establish some of the framework for today's conversation, I wanted to talk just a little bit about this particular type of funding. These grants help improve access to public transportation by building partnerships among healthcare providers, transportation providers, and other key community partners. These grants fund innovative projects for the transportation disadvantaged that improve the overall coordination of transportation services and non-emergency medical transportation for hard-to-reach populations like older adults and people with disabilities. Projects that are funded include things like the deployment of ride coordination technology, establishing or expanding one-call, one-click services, vehicle purchases, and certain types of mobility management projects. ICAM is a competitive funding opportunity authorized in Section 3006B of the Fixing America's Surface Transportation, also known as the FAST Act, and that is found in Public Law 114-94. The most recent awards were announced in June of 2024, and those awards reflected the review of responses to a notice of funding that went out in fall of 2023. And those awards from June 2024 included funding for 17 projects that totaled over $7.8 million. And one of those projects that was awarded was to the Fallon Piaute Shoshone Tribe. And it has been my pleasure to learn more about their project, assist them as they have started to develop their performance measures, and also provide them some initial technical assistance in this grant period. With that, I would like to introduce you all to Amy Homer. She is the transit supervisor with the Fallon Piaute Shoshone Tribe, and she is going to tell us a little bit more about the tribe.
Hello, so my name is Amy Homer, and I'm the tribal transit supervisor for the Fallon Piaute Shoshone Tribe. The Fallon Piaute Shoshone Tribe currently has a membership of approximately 1,576 people. The reservation was established in the rural area of Churchill County in northwestern Nevada in 1887. The Stillwater Reservation has a population of about 672 and is located roughly 12 miles northeast of Fallon. The Fallon Indian Colony has a population of about 98 people, and it is located 1 mile northeast of Fallon, so approximately 11 miles from the reservation. The Tribal Transit Program was established in 2019 as a resource that enables members of the community to fulfill everyday needs that are vital to their well-being. Some people that are living on the reservation or Indian Colony rely on TTP as their sole source of public transportation.
Thank you. And can we advance the slides too? One more. There we go. Thank you. Thank you for that introduction to the tribe. I was wondering if you could tell us a little more about the members of the tribe that are involved in transportation and grants and their roles, including a little bit more about you, Amy, and your day-to-day and what your time in your role has looked like.
Okay. Well, our team consists of our chairwoman, which is Kathy Williams-Toomey, our transportation director, who is my supervisor, Andy Higgs, our grants administrator, which is Linda Lobes, and myself, the transit supervisor, and I'm also the on-demand driver currently. I was hired in June of 2022, and I had zero experience in transit or grants. I had to learn everything from the ground up, from my vehicles, my supplies, my budget. The program had not been running for over 6 months prior to me, due to the last supervisor moving. And prior to her, they were shut down for COVID. So I had to start from scratch. I started going through old files. I started going through old emails, anything I could find, talking with finance to find out what my funds are, what do I have available, talking with the grants department to see what grants I can apply for and where do I look for these. Um, my supervisor at the time had asked me if I wanted to go to the RTAP Tribal Training Mini Conference in Flagstaff. So I said, of course. And I took the opportunity. And here is where I started learning or started getting my resources. And I learned so much, not only from the conference itself, but from other tribes that were there that were successfully operating and running their transit program. So that's how I started growing our program.
Yeah, thank you so much for sharing that. And I think that's probably relatable for a lot of people, whether they're new in their role as a transit supervisor, transportation planner, or just someone that is really trying to grow their transportation program and learn about what's available. I think you listed some good suggestions there for people that are new and how to get up to speed on what's out there and what's available.
Yep.
Um, Next slide, please. And so, Amy, can you tell us a little bit about the transportation programs, services that you all offer, what some of the ridership needs that were identified are, and what some of those barriers and needs are?
So our ridership consists mostly of, well, our on-demand ridership consists of elders, some caregivers, people with disabilities. Our fixed route consists of everybody. We do not provide rides to only tribal members. We are open to the public. However, 95% of our ridership is tribal members. Both our fixed route and our on-demand services currently run Monday through Friday from 8 a.m. to approximately 4:30 p.m. However, we do plan on extending our schedule to include evening and weekends to better accommodate those who work or go to school. We would like to eventually expand to a second bus also. Besides the tribal transit, the tribe only has a couple other options for the elderly or disabled. The clinic has the CHR, which is Community Health Representative Program, and the Senior Center, I believe, has a van that offers some rides. So the TTP tries to bridge that gap to ensure that everyone is able to get much needed medical appointments, access to food, food banks, and social activities. Now, some of the barriers that we've came across are our on-demand van currently is not wheelchair accessible. So that limits what I can do in the rides until we can get our van through the ICAM grant. CART and other public transportation in town does not always have a route to the reservation and or they charge a fee. We do not charge a fee. So a lot of our elders are on a fixed income and those fees tend to add up quickly and it's just something that they cannot afford. Another barrier is elders trying to find rides through family or friends. Sometimes they don't have them. So, or the family, they work, and they're not able to take off time to get them to the medical appointments or even lunch dates for the senior center.
Yeah, I think you touch on some really important points there, and some of the things that I know stood out from our initial meeting after the ICAM kickoff, and some of the things that we've talked about since then. And given how many members of the tribe are elders, people with disabilities, and also some of the just the geographic reality between the city of Fallon, the colony that is about a mile outside of Fallon, and then the reservation that's 11 miles from from the colony and then 12 miles from the city. You can certainly see how all of these factors can contribute to social isolation, and factoring that in as well as the need for support for mental health, emotional well-being, socialization, as well as those medical appointments. I think that's a great point, Amy. Can you tell us a little bit more about who some of the closest community partners are, and what does that partnership look like as you all work together to try to meet the needs of elders as they're trying to access transportation services?
Right. So we currently work with our tribal health clinic, which is located on the colony. They've been a great support for our transit department. They also assisted myself and our grants administrator, Linda, in applying for the ICAM grant. We get weekly calls either from the clinic itself or they refer a tribal member to transit to help get people to their appointments. We have the wellness center, which is located out here on the reservation, which there's a gym, and they offer exercise programs and diabetes programs and some other programs for their wellness. We also work with Voc Rehab, our Voc Rehab program, and it's on the colony. And they contact us to assist people with disabilities to get to potential job opportunities or volunteer work. The senior center, which is out here on the reservation, we work with them closely to ensure that everyone has the opportunity to go to lunch on the Monday through Friday and to socialize. And they offer all kinds of activities to keep our elders active, and it helps them without not feeling isolated. Occasionally, we will have a dialysis patient who needs to go into town for treatment. So I have worked with DaVita a few times. With our new van and hopefully another driver in the future, I would like to pursue more interaction with DaVita and our other local medical providers. This van will provide an increased capacity to better serve our members. Another non-travel partner that we have is our local CART. It's the Churchill Area Regional Transit. We partner with them to transport people wishing to utilize their service that travels outside of our service area. So we work really closely with them. And as we expand, we hope to really be able to increase that partnership.
Yeah, so the need for this van has really kind of made itself clear as you have done this planning, have been working with these community partners, and you're really working to not just grow the numbers of people who are accessing the service, but to kind of help with the overall capacity of the network with these other options for transportation. Can you tell us about how many rides a week are currently provided by on-demand services?
Well, just the on-demand, I currently do anywhere from 2 to 6 rides a day, but I kind of have to limit myself on what I can do due to my main job as a supervisor and the capacity of our little van and wheelchair accessibility. But I try to accommodate all rides in the best way that I can.
Gotcha. And it sounds like you've got a great network and everyone works together to make it work.
Yeah, we
Um,
try.
Next slide, please. So between the support of tribal leadership, the identified need to extend the hours and the availability of on-demand services, and then this really strong sense of partnership among tribal departments, really kind of created the components to demonstrate the need for a new ADA van with a wheelchair lift as part of your ICAM. When did you first hear about ICAM and begin applying? I know you mentioned grants manager with one of the other tribal departments, but what was that process and timing of hearing about, applying for, and what some of your internal processes are like? I think that would be really interesting for everyone to hear.
Okay. Well, I hadn't personally heard about ICAM until that last grant opportunity was announced in November of 2023. That's when I heard. Both Linda, our grants administrator, and the health center director had both sent me the NOFO. The health center director stated to me that on the health center side, they could really use more assistance in transportation for the patients to get to the medical appointments. So I got with Linda to discuss moving forward with this opportunity and purchasing an ADA wheelchair accessible van. We then pulled in the health center's grant writer because he was more familiar with these kind of grants. We would frequently have meetings and assign tasks. For weeks, we did this. I got the quotes for the van and what van that I felt would best suit our department. I provided Linda with my scope of work and all the logistics, and then Linda took it from there. We, once all that was put together, we had to go in front of our council and get authorization to apply for this grant and ask for any funds that we may need to assist with this.
The
Once
match
we
and
did get
everything.
approval
Gotcha.
from council, which is, they let us know right then we moved forward with applying for the grant, and Linda handled the grant writing and the submitting. She's amazing. And then
Gotcha.
months later, we were awarded the grant, so that's great.
Gotcha. Thank you for sharing that process. And I think that's such an important point when it comes to exploring new funding opportunities, the actual writing, responding to the request for proposal, and just the whole process of grant management throughout the cycle of the grant is leaning on the expertise and skill sets of everyone involved. Some people have different expertise like grant writing, speaking to the need, and then managing the budgets. And I think all of those things can work together so well. Just making sure that there is that consistency and commitment to making those weekly meetings happen. Because when there are small teams, as you all know, that also means that everyone has competing priorities and shuffling different priorities. So the name of the project itself, the Fallon Piaute Shoshone Comprehensive Mobility Project, a collaborative approach to community transportation, I think really encompasses the collaboration that you're speaking about, both internally amongst the tribe and the tribal departments, and then also externally with your community partners. I think one of the other things that stands out with your tribe's approach to expanding transportation services is kind of the scaling and timing and the clear next steps that you all have developed to meet the tribe's transportation needs. The vehicle purchase as part of the ICAM grant is a piece in the broader scalability of the transportation program. And we'll talk a little bit about that. But within the ICAM project itself, to really make sure that this is growing on-demand services the way that you all are wanting it to, you all have identified some really specific steps to make this a replicable approach for other small or rural tribes. So can you tell me a little bit about those steps for the ICAM grant, like the short term, the midterm, and the long term, just so you all, yeah.
So Linda helped come up with these goals, or Linda came up with these goals, which our short term is the ADA van purchase and outfitting, develop specific performance measures for data collection, and inform partners and future partners of our increased capacity to offer more on-demand rides. As far as midterm goals is to see a 10% expansion in rides from pre-project numbers and reassess on-demand procedures and schedules. We would like to update the website and inform partners of relevant updates and create a survey to ascertain overall success and impact. And then our long-term would be to see a 20% expansion in rides from pre-project numbers and create a final survey targeting riders and partners to compare actual outcomes with expected outcomes and submit a final report for the ICAM grant with the compiled data from the pilot program.
Yeah, thank you for laying out those steps. I think a few things that stand out there, certainly the surveying and getting the feedback and making sure that that you are seeing the growth that you want, and also it's meeting the needs of the riders. I think that's such an important piece when people are thinking about additional funding and really making sure that it is being effective.
Right.
Um, Once the van is procured and in use, what about your day-to-day as the transit supervisor will be different, both short-term and long-term?
Well, it's going to be busier for sure. If it's just myself driving at first, I will absolutely have to prioritize my days around office admin work and rides. But my long-term goal is if I'm able to hire a second driver, then I can focus more on the outreach and the scheduling of rides and just expanding that part of the program. I'm just waiting on our funding from our 5311 grant that I was awarded.
Well, that's great. That's probably a great time for us to talk a little bit about one of the things that has really stood out is the idea of scalability, um, and how to support other small programs that are looking for a roadmap, if you will, of how to plan, apply, and then operationalize these additional funding streams that will enable meeting the needs of everyone in the community. So when you first started, uh, 5311 was in place. So that's where you mentioned earlier learning through National RTAP and doing a lot of peer-to-peer learning and sharing and just curiosity with all the resources that were available.
Yes.
And then through that, you identified some of the needs, like the need for the new van, and then the opportunity for that funding presented itself through ICAM. So that was kind of the next step in that roadmap. And then the next step, given the assessment and surveying that you're doing with ICAM, is going to help inform some of those next steps, like the 5311 that will further expand your capacity. And then I know one of the other things that you have mentioned possibly in the future is applying for 5310. I think this all tells everyone a really interesting story um, about scalability and how to slowly and intentionally add these additional opportunities for growing their transportation programs. I know at NADTC, one of our areas of technical assistance is around 5310. Given what you have learned and your experience so far between 5311 and the ICAM grant, what kinds of resources would be helpful if you were to apply for 5310 in the future?
Um, I lost my spot. Hold on. Well, what I learned about the ICAM process was to have frequent and consistent internal communication throughout the whole grant process. To engage the state of Nevada DOT really early in inclusion into their STIP, as a process can take months. The requirement for this grant to be included in the STIP had to be ironed out as Linda was getting pushback from NDOT about them not including us in the STIP. So the FTA needed to get involved and tell them that they needed to. The resources that were helpful were the ICAM manual and our Region 9 project managers. As far as what would have been helpful is a better understanding of exactly what a STIP is and how to get that included. More info on how to meet certain requirements of the grant that differ from 5311 would have been helpful.
Well, that's really helpful for us. That's really helpful for us to know so we can provide better technical assistance moving forward. So thank you for sharing that.
Mhm.
Um, I also wanted to ask what we've mentioned kind of funding streams, communication, both internal and external. Any other advice you would give other tribes that are considering growing their transportation programs?
Do your research. How much would you need in operating costs? What kind of grants are out there that can support your continued operation, or how can you generate income to support your operations? And don't be afraid to reach out to everyone, other tribes, RTAP, the FTA, the NADTC. They all have great resources and they can direct you to other points of contact. Also, go watch every recorded webinar you can.
Well, speaking of that, I know our partners at National RTAP have lots of resources available related to 5311, and certainly in ADTC, we have resources for 5310, and I will also make sure to include, if anyone is curious to learn more about the ICAM funding, we will be sure to share a link to learn more about that and future funding opportunities there. We'll be sure to include that with the materials. So with that, I think we can go ahead and take a look at the Q&A and see if we have any questions. I don't see any. If you have any questions, feel free to add those. Give everyone just a moment. What are the hours of operation? I wanted to clarify, it sounds like the hours of operation for the current on-demand services, is that correct?
For
Okay,
me,
Amy, can you clarify what the hours are for on-demand services currently and what the vision is for those moving forward once the additional van is in place?
yes. Currently, our hours are Monday through Friday, 8 to 5, 8 to 4:30. However, the on-demand can vary depending on if someone has an appointment at 4, then I'm going to run late. Going forward, we would like to extend some evenings until probably 9 p.m. and then weekends, so they're available to get more opportunities, more appointments, or whatever it is they need to do, go to the store, anything. So I would like to expand evenings and weekends.
All right, I'm going to take a look at a few more questions. All right, we have another good question. What kind of workforce considerations are there for starting a program like this? Drivers, mechanics? I think that would probably be individualized, but wanted to see what your thoughts are on that, Amy. What kinds of things have you considered as you have been in your role in terms of scheduling, drivers, skill sets, things like that?
Um, I have my driver, I have myself. We do all our mechanic work in town. We have a hired person that we go to as of now. Everything, yeah. So I'm not sure. I'm not sure on that question.
All right, well, we will do some additional follow-up and we will flag this one for some additional follow-up. Um, all right. Well, thank you all for your questions. And if we did not get to them live, we will follow up individually with answers. Can we advance 2 slides, please? All right. I see we had one more question pop up. What is the approval process like on your reservation with elders specifically for projects like this? Great question.
We have a really good approval rate. Our tribe is very focused on the elders and anything to help them in any kind of way. That the approval process is pretty good. We have a lot of support from our council to support not only just the members, but especially the elders and people with disabilities. So that part is great.
All right. And then one last question. Are there any fares associated with the on-demand services?
No, we currently do not charge for any fees for it. That may change in the future. We're trying not to. So as of right now, no, there are no fees or fares, either on the on-demand or the fixed route.
All right. Well, thank you. Next slide, I think we can go ahead and close out. All right, so thank you all for your time and joining us today. We would appreciate your feedback on the survey. I'm going to drop the link. I think we may be having some issues with the chat function, so we will follow up and send the survey link through email. We really would appreciate your feedback to help inform future webinars and learning opportunities like this. I thank you again for your time, and we will send the slides and recording in the next few days. Thank you.